wellness revolution starts now.
Welcome to the program. My name is Bryana Burken, Pharmacist and Physician Liaison with Physicians Preference Pharmacy. One of the biggest successes or actual potential hangups for folks when they come into us and they take on our full health and wellness program can be the yeast-free eating program. So today I want to give some attention to this program, unpack what it means, what we're actually trying to address as this part of your health and wellness journey, and why it's so important. As one of the pharmacists here at Physicians Preference Pharmacy, when I counsel guests for the first time, especially after their new guest visit, we call our patients guests here. One of the biggest hangups or misunderstandings from them can be why we actually incorporate the removal of yeast from the body into the program. So that's what I'm going to explain today. I want to explain to you exactly what the yeast overgrowth is coming from, why we need to attack it, what the overgrowth of yeast in the body actually looks like, and what those implications are. What do those symptoms actually show up as? And then we're going to unpack some of the dietary approaches as well as the prescription approaches that complement those dietary changes so that we can be sure that we are most effectively attacking the yeast within the body. Many people don't even know that we naturally have yeast in our body. We're very familiar, most familiar probably, with talking about yeast infections in the terms of vaginal yeast infections for women. Yes, it can show up there, but this is a much broader conversation. So this conversation is actually for men and women and children alike. And then I want to finish up with what you should expect on the other side of this yeast-free cleanse. So I want to help you understand this a little bit better so that you feel that you can attack it. You understand our approach, its place in therapy, so that we can move forward together. So first, I want to talk to you about what Candida is. So Candida is a type of yeast that lives in the gut. It lives on the skin. It lives in the GI tract. It lives in the vaginal tract. It lives down through the esophagus. So really everywhere on and in the body and through that digestive tract, it lives. We also want to consider the areas that have close proximity to the digestive tract, which is why we oftentimes do talk about those vaginal yeast infections that can be affected by overgrowth. So oftentimes when we are having these conversations about bringing the immune system and bringing the body back into balance, we need to have a good understanding that things like bacteria and fungi don't have to be bad until they overgrow, or what we call achieving an opportunistic infection. So an opportunistic infection is when something in the environment, like let's say that your gut is that environment, says, oh, good. All right. So this human's immune system is depressed. This is my chance to take this opportunity to overgrow and to overtake the environment. So again, the fungus, the yeast, the bacteria, they're not bad until they overgrow and they completely dominate the environment. So that's what we're talking about. We're talking about the overgrowth of yeast, not just in the gut, but also systemically, which means throughout the bloodstream and throughout the rest of the body. So Candida, or Candida albicans, is the primary fungus that we are trying to address. Candidiasis is the overgrowth of that Candida albicans and potentially other yeasts in the body that create that opportunistic infection, meaning that they take over and then they cause symptoms. So what are those symptoms? Those symptoms that folks usually show up to us with, and a lot of times the reason that people will actually come to us in the first place, to Physicians Preference Pharmacy or to the Hotze Health and Wellness Center, is they feel bloated. They feel fatigued. They have constant headaches. Sometimes they have unexplained skin rashes. They've maybe been diagnosed with Hashimoto's, other autoimmune conditions, chemical sensitivities, mold sensitivities, also persistent yeast infections too, which typically is the most noticeable for women with recurrent yeast infections because it's a little bit more obvious for women, but it's not, again, not just isolated to women. And then also very common, this is probably one of the most common symptoms that we see people come to us with initially, is brain fog. And then again, a very noticeable Candida overgrowth is flush, which is that thrush. Oral thrush is very common on the inside of the mouth, notably on the tongue, and you'll see that as a white film coating. That's a good indication that there's probably some yeast overgrowth that's starting not just within the mouth, but is probably persisting throughout the digestive tract. So this begs the question, why does this even happen, right? There are a lot of things that can create an environment within the body that allows these yeasts or bacterias to find themselves in an opportunistic environment and take over. Something you might be thinking, and probably the most obvious one, would be stress. So whenever you are stressed, and particularly stressed chronically, long-term, months, years on end, that slowly depresses the function of the immune system. The immune system is supposed to fight off the overgrowth of these things and also keep bacteria and viruses and yeast and other things in balance. And so when it's not able to do that, because the immune system is not functioning in a robust way, then we are more likely to be exposed to infections, these opportunistic infections, and even secondary infections, which just means it's the second infection that comes because continually our immune system is ramped down, and we certainly don't want that. Something else we commonly see here, and that we also treat at the Hotze Health and Wellness Center, are food allergies and sensitivities. So there's a place in therapy specifically for approaches like low-dose immunotherapy to incorporate into this. Although that's not the topic of this particular episode, it can be very, very helpful to unwind some of the persistent food sensitivities that folks have. Now, one thing I think people don't understand, it's not probably discussed often enough, is the link between yeast overgrowth and food sensitivities. Something very interesting about food sensitivity testing is that oftentimes when you do a food sensitivity test and you see that long list of foods that you're supposed to avoid, it's like a shocker because most of those are usually the foods that you eat routinely. Do you think it's just a coincidence that you happen to be sensitive to all those foods, or do you think that maybe there's another link going on? We talk a lot about leaky gut here in our approaches, and one of the reasons why we utilize dietary changes as well as prescription interventions to help repair the gut lining, keep the nutrients in the gut, and keep the toxins out. Once the gut, which is very tightly held together by its wall, and the contents are supposed to stay inside, once the wall of the gut starts to weaken and spread apart, what's it going to do? It's going to allow unwanted chemicals and other toxins into the gut, including food particles. There will be exchange in and out of the gut. So when we eat something, we expect the food and the nutrients to stay in, the toxins to flush out. But once we start losing some of those nutrients or molecules into the bloodstream, that's when the bloodstream goes boom, it tags it, and it says, if I'm exposed to that again, that can potentially be an allergy or a sensitivity. The good news about this is that when we come in and we repair the gut, and we do this as an underlying foundation for healing hormone imbalance, healing the immune system, your body will be more receptive to those therapies because we have already healed and re-strengthened the gut. So I cannot emphasize how important that is. Again, when I counsel guests on initial consultations, oftentimes they're a little bit leery about starting this because it requires dietary changes. But again, to set yourself up for success, do this first, and it'll allow your body to receive the other therapies better. Now, depending on the extent of the Candida overgrowth that you have, the duration of therapy may be somewhere between 1 month and 3 months. Most of our guests typically do this program once per year. We oftentimes will make a push around January because people carry the most motivation at the beginning of the year, which makes sense. So we want you to understand that this is not one and done. Even the employees here at Physician's Preference and the Hotze Health and Wellness Center, we do this ourselves, along with some items that are offered at Physician's Preference vitamins. And so we collectively come together to help you utilize all of these approaches, from vitamin mineral supplementation, probiotics, prescription options, which I'm going to show you here in just a moment, and then, of course, the dietary changes that will be recommended by your physician as well. So if you've never done the yeast-free eating program before, here is what you should expect. Oftentimes when we get prescriptions from outside providers to physician's preference pharmacy as well, they aren't really sure how to prescribe this. So this information is also for your physician if you'd like to share with them, or if you're a physician listening, this is the approach that we take, and we're happy to share because we've seen such great success with it. So initially, before we start on hormone therapy or we start on thyroid therapy or immunosupportive therapy, we like to clean up the gut. So what does that look like? Perhaps you come in, you get lab work, you're evaluated on your symptoms. We know that there's some dysfunction or imbalance in the thyroid or sex hormones, for example. You take those prescriptions home, but starting on day one, which we're saying is, let's just say the first day of your visit, we want to wait about 2 weeks until we start into this yeast-free eating program. The reason why is that chances are when you come in for your new guest visit, you are going to be at an all-time high for the amount of yeast exposure or overgrowth in the gut and throughout the bloodstream. So first, what we want to do is we want to remove the contributors to yeast and allow that to naturally flush itself out. What I mean by that is that you may be ingesting yeast through the diet. So you might be eating high yeast foods. And hear me when I say this, you might also be eating or consuming foods or beverages that feed that yeast. The yeast is a living organism and the yeast needs to eat. So if you have persistent sugar cravings, this could potentially be an indication that you have Candida or yeast overgrowth in the gut, because yeast loves sugar. And so it's going to send that signal to your brain: feed me, keep this growth of the yeast going, feed me sugar so I can keep growing. And so one of the things that we do is we eliminate the consumption of sugar. Also, high yeast foods and other items that can feed the yeast, like dairy and even sugars like natural sugars. Sugars from fruits must be eliminated. Most of this elimination is going to take place over the course of about 1 month, and then you can start to reintroduce them in. So we're talking about milk products, foods that are high in yeast, sugar, also alcoholic beverages for about 1 month as well. So I will say that depending on what type of diet you currently follow, this will be more challenging for some than it will for others. If you're already, let's say, on a gluten-free diet, you're going to find this much easier, not necessarily because gluten equals yeast, but a lot of foods that contain gluten also contain yeast. So yeast goes into the food to make it rise when you bake it. Think a lot of the baked goods, think pastas, think breads, think things like that. The purpose of this dietary change is, first of all, it's not forever, it's not long-term, and it's not meant to be highly restrictive, although it is considered a yeast elimination diet. But as long as you're eating whole meats and vegetables and you're keeping it fairly plain, you're going to have a pretty easy time with this, quite honestly. Foods that are okay, for example, meats, eggs, salads, dried beans, avocados, are going to be on the okay list. And then foods that should be eliminated, again, the sugars, the dairies, the flours, the pastas, even vinegars and some of your fermented foods, because that can increase the yeast overgrowth, and there is some cross-reactivity there as well. Now, in addition to removing those foods or the foods that feed the yeast for about the first month, usually about 2 weeks after you've been decreasing the consumption and finally eliminating the consumption of yeast in the diet, then we want to incorporate the items from Physician's Preference Pharmacy that are very clean to help perpetuate the excretion of yeast from the body. So some of it will be natural. You want to be sure that you are drinking plenty of water as you're flushing the yeast out, because we want to get it out as fast as we are killing it off. So a couple items that we offer that I want to touch on, and I've brought 2 of them here with me today. One of them is the compounded nystatin. So nystatin is a staple for what we use. It doesn't matter if you come to a physician's preference pharmacy or if you go to your corner store and you get the commercially available nystatin tablets. But what does matter is which form you use. Different doctors will use different prescriptions for really the same type of medication, which is nystatin, and this is the most frequently one that is used. However, you need to know what's inside of the product. So we just discussed how yeast feeds on sugar. This may or may not surprise you that this morning I pulled 2 ingredient lists from 2 different commercially available products for nystatin, meaning the commercially available manufactured drug. And both of these nystatin tablets have sugar in them. So you're going to take a medication to kill off yeast, which feeds on sugar, that has sugar in it. That doesn't make sense to us here at Physician's Preference. So what we've done is we've prepared, and we've been doing this for years, prepared a capsule that is free of sugar, free of dyes, and we also offer the oral suspension that is good for those that cannot swallow capsules, or perhaps kiddos that are not really old enough to do that yet, or they're adverse to swallowing capsules. So we do have those different options. Some of the other inactive ingredients that you may find in some of those commercially available tablets would include the sucrose, like I mentioned, cornstarch. You have different dyes in here. So yellow number 6, red number 40, blue number 4, polysorbate 80. So a lot of inactive ingredients in here that we just simply don't want you actually utilizing because they're counterintuitive to your therapy. And if you know anything about what we do here at Physician's Preference Pharmacy, we oftentimes talk about the hormones and how the hormones in our preparations are free of parabens and some of these hormone disruptive or endocrine disrupting ingredients that if we're trying to treat someone for hormone therapy, the last thing we want is an ingredient in there that disrupts their hormones. So it seems straightforward, I know, but we just need to be very clear about what's out there and how our products are different. So for ours in the nystatin product, it's the same dose as what's commercially available, but for those people, especially that don't tolerate those inactive ingredients or it can inhibit their therapy, what you're getting in here in each capsule is just the nystatin powder along with microcrystalline cellulose, which is a standard filler, and then mag stearate, which helps us to blend those batches evenly so that you're getting 500,000 units of nystatin in each capsule, which is the dosage of this. So when you first do start the nystatin, it's important to be off of yeast-containing foods or yeast-feeding foods for about 5 days. I usually say a week just to make it easy. And when you receive this prescription, you'll have all the instructions on the front of the bottle. But essentially what we do is we recommend that you take 1 capsule with each meal for 2 weeks, and then you bump it up to 2 capsules with each meal until you complete this bottle. So this entire bottle, which may look large, is going to last you a little bit over a month because you start low and you go slowly. Now, this is addressing just the yeast overgrowth in the gut specifically, which is what we refer to as a localized treatment. So we just want to address or kill off the yeast in the gut. That's going to be really important. It's going to stem from there, and that yeast may spread systemically to the rest of the body like we discussed. So after we finish this first bottle of nystatin, then we come in with 1 week of fluconazole. So you may be familiar with that as diflucan, but the generic name for it is fluconazole. Fluconazole is used for yeast overgrowth of many types, but it is also used in this regimen to come on the back end of this and address any yeast that has made its way into the bloodstream. If we go back and we remember what we talked about a few minutes ago, we talked about the connection between a leaky gut and food sensitivities. A lot of times I'll see folks that have been avoiding certain foods for years because it showed up on that food sensitivity test, when quite honestly, we probably could have healed the gut in the first place and made them tolerate those foods again. So again, the idea is not to be overly restrictive here. It's just to get crystal clear on what you can and cannot eat for the duration of 1 to 3 months, however long your doctor wants you on this program. And then you can start to reincorporate those foods back in slowly. Something that I notice personally, and a lot of our guests notice, is once they go back and they try to reintroduce those foods, they oftentimes don't crave them, but it will be a little bit different for everybody. I think it does help to streamline the dietary choices a little bit better going forward. Now, for those that may be excreting the yeast that they're flushing out through the nail beds, which is fairly common, oftentimes it'll come out in the joints, it'll come out, you'll excrete it naturally as well, but can also release itself or come out through the nail beds. And so we do make a proprietary antifungal nail solution that can be used underneath the nails of the hands and underneath the nails of the toes if you start to get that yeast overgrowth that's coming out of the nail bed. And so like with any other topical nail solution, it'll need to be used for a few months. that is how it allows itself to penetrate the nail bed and get in there and actually address the root cause of what is going on. Now, as far as tying this all together and talking about the dietary as well as the prescription options, you need to understand what it can look like for you on the other side. So we talked about how people usually come to us with brain fog, with bloating, with belching, with abdominal swelling. These are a lot of symptoms that we often see that are congruent with yeast overgrowth. There's also evidence to show that there is a link between yeast overgrowth and mold toxicity and cancer showing up. And so we want to be sure that we are minimizing the amount of yeast overgrowth in our body at any given time. So on the other side of this cleanse, what you should expect is to oftentimes lose weight actually, because we're removing an opportunistic infection or overgrowth that causes a lot of bloating and swelling and water retention. So you can generally expect some weight loss. You can expect less abdominal bloating and hopefully full resolution of that, lifting of the brain fog, better energy, because your immune system is also bouncing back as we are healing the gut. So this is one of our approaches to heal leaky gut, to get you back on a track to health and wellness so that when your doctor incorporates things like hormone therapy, again, your body is going to be more receptive to it. That environment in the GI tract, we must protect. There is a lot of conversion of hormones from their inactive form to their active form in the GI tract. So if you're paying a lot of money for hormones or other therapy and you're thinking that you're going to respond to it and you're not, be sure that you and your doctor together are addressing any potential yeast overgrowth in the gut as well. Certainly, if you have any questions about our specific formulations at Physician's Preference Pharmacy, or if you're looking to start working with a practitioner who can help you address potential yeast overgrowth, please feel free to give us a call. Our phone number is 281-828-9088, and it would certainly be our privilege to serve you. At Physician's Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.